Hello and welcome. Thank you for joining today's presentation, Learn What Your Doctors Know About Cancer Treatment. My name is Tanya Fisher and I use she, her pronouns. I'm a medical writer for patient information at National Comprehensive Cancer Network. A little bit about me. I hold a master's in educational leadership from Northern Arizona University and a master's in library and information science from University of Wisconsin-Milwaukee. I also have a BFA in painting from Arcadia University. I have experience in public and medical libraries, as well as patient education and teaching. I am chair of PA Forward's Literacies team. Thank you again for being here today. Objectives and learning outcomes. This presentation will provide an overview of NCCN, NCCN Guidelines, and NCCN Guidelines for patients. By the end of this presentation, you will have increased knowledge of clinical practice guidelines and standard of care, increased knowledge of patient guidelines, and increased awareness of cancer-related resources. NCCN stands for National Comprehensive Cancer Network. NCCN is a not-for-profit alliance of 31 leading cancer centers across the United States devoted to patient care, research, and education. Its mission is to improve and facilitate quality, effective, efficient, and accessible cancer care so patients can live better lives. This mission is accomplished through the NCCN Clinical Practice Guidelines in Oncology, or NCCN Guidelines. Clinical Practice Guidelines, or CPGs, are treatment guidelines. NCCN guidelines are the standard of care for cancer in the United States and are used worldwide. 81 NCCN guidelines feature 206 algorithms that apply to 97% of cancer cases in the United States. Guidelines include prevention, cancer screening, survivorship, and supportive care. NCCN guidelines are the standard of cancer care and basis for insurance coverage in the United States. They are the most thorough and most frequently updated clinical practice guidelines available in any area of medicine. These guidelines are free and can be accessed at nccn.org. Registration is required, but this information is only used to track downloads. Here's a screenshot of the website to give you an idea of what is available. This is an incomplete list. On the left-hand side, you can see some of the other products we offer, like harmonized guidelines, international adaptations, and evidence blocks and things like that. In 2020, there were almost 12 million downloads from over 180 countries. Each guideline is developed by panel members selected by member institutions. Panel members are not paid for their time. Each panel has 31 to 35 experts. More than 1,660 panel members participated in developing and updating the NCCN guidelines. Panel members contributed more than 37,000 hours in 2020. This is an example of the panel for primary cutaneous lymphomas. These are skin lymphomas, which are not skin cancers. They are completely different diseases. Panel members are recognized for their contributions in both the clinical practice guidelines and the patient guidelines. You can also see at the bottom right that the NCCN staff who are involved in the clinical practice guidelines are recognized. This is always a coordinator and a scientist. The scientists are responsible for the discussion and making sure that things are clinically accurate and the research that goes into it as well. Guideline development follows a rigorous formal process. There is at least one panel meeting per guideline each year, with multiple interim updates posted throughout the year. Here is a screenshot of derivative products that are updated with each guideline. For example, every time there's a new drug approval, not only is the clinical practice guideline updated, but the drug compendium is updated along with the chemotherapy order or dosing templates. A lot of work goes into all of these products. And with each update, the rest of these compendium are updated within 48 hours. So it's a lot of work that involves a lot of people to get it done. NCCN Guidelines for Patients, also known as patient guidelines, are based on the NCCN clinical practice guidelines. They explain the same options for cancer care, but are written for patients and their caregivers, family, and friends. Here is a sample of some of the covers. So I mentioned primary cutaneous lymphomas just a few slides back. You can see there's MDS, breast cancer, liver cancer, survivorship. The NCCN Guidelines for Patients are funded by the NCCN Foundation. So the NCCN Foundation is actually a separate nonprofit from the NCCN itself. It's a nonprofit kind of within the organization. There are firewalls present. And so on the left, you have a sample of the pediatric ALL patient guideline. On the right, what the clinical practice guideline looks like. The NCCN Foundation is a nonprofit organization that raises funds for NCCN patient resources, including new and updated patient guidelines, as well as webinars and animations. These are funded using financial support from generous donors. Donors do not have input on the content of the books or other products. Currently, there are 56 patient guidelines and 35 translations in 12 languages, including Czech, Croatian, Spanish, Russian, Korean, and Japanese. In 2020, there were over 2.2 million guideline downloads. So here's a complete list of available books. I mentioned that there are currently 56 guidelines. When I started about 2.5 years ago, we had half that. So that just shows how much we are growing as an organization. NCCN has been around now for 26 years. And our team of writers, there are 5 of us. When I started, there were 3. The NCCN Guidelines for Patients has been around for 10 years, and it did start with one writer. Some of the books that I've worked on have been the pediatric and adult acute lymphoblastic leukemia, the acute myeloid leukemia. You can see there's AYA, adolescents and young adults, bone cancer, all 3 breast cancer books, chronic myeloid leukemia, gallbladder and bile duct cancers, kidney cancer, liver cancer, lung cancer screening, mycosis fungoides, Sézary syndrome, prostate cancer, primary cutaneous lymphomas, pancreatic cancer, soft tissue sarcoma, stomach cancer. Yeah, so that I think that about covers it. That is a lot. It's a lot of books, I know. I can tell you that not all cancers are alike, and you cannot take what you know about one cancer and apply it to another. So you can't take what you know about chronic myeloid leukemia and apply it to acute myeloid leukemia. They're not even the same disease, not even close. The same with skin lymphomas. I mentioned skin lymphomas are not skin cancer. So you can't, you just can't take what you know about kidney cancer and apply it to stomach cancer. This is a screenshot of the website. The version identifies the clinical practice guideline that the book is based on. So for example, with multiple myeloma, it is based on the 2019 clinical practice guideline. Multiple myeloma has recently updated, so it is now based on the 2022 clinical practice guideline, which is very exciting. We make every effort to keep the books updated as frequently as we can. Some are updated every year, some every 2 years, some every 3 years. It's all funding dependent, so that does make it a challenge. You can view and download free copies of the guidelines from patients from the NCCN website. High quality printed copies of the book can be purchased through Amazon. NCCN guidelines for patients are also available free on our mobile app. So what makes the guidelines for patients an authoritative resource? It is evidence-based, unbiased, and timely. The clinical practice guideline version used is noted on page 2 of every book. Each book goes through a rigorous internal and external review process. Medical reviewers are from different fields of medicine to ensure clinical accuracy across a range of procedures and treatments. We have subject matter experts or SMEs on staff. These include scientists, nurses, oncologists, pharmacists, and imaging and radiation experts. We have in-house graphic designers who provide professional design and layout using a standardized format and who apply American with Disabilities Act ADA design principles. Our books are available in a variety of formats and can be read using a screen reader. Books are written in plain language using health literacy and numeracy principles. Medical terms and acronyms are defined. The books aim to reach a large and diverse audience. Content includes testing, diagnosis, staging, and treatment options. Every book contains a chapter on shared decision-making with questions to ask your doctor. And every book includes a chapter on clinical trials because NCCN believes the best management of those with cancer is in a clinical trial. Here's the official patient guideline development process. You can see a lot of work goes into each book. We are continually updating our books. This process starts with attending panel meetings, learning the disease, how it is diagnosed and treated. So you have to learn all of that before you even begin writing. And even if you're updating a book, so we update books, some books we write from scratch, they're brand new, some you're updating a previous version. Maybe you worked on the version 2 years ago, maybe you inherited the book from a writer from 3 years ago. Regardless, you still have to learn the disease. So let's talk a little more about the books. The patient guidelines answer 3 main questions. What is it? How is it diagnosed? And how is it treated? What is it is always the first chapter. It describes the basics about the disease, about the organ or tissue where cancer is found, how cancer spreads, etc. So in the example on the left for oropharyngeal cancer, we have the throat, what is head and neck cancer, risk factors, treatment types, and review. For stomach cancer on the right, so the first chapter, stomach cancer basics, the stomach, parts of the stomach wall, stomach cancer, how stomach cancer spreads, and key points. We now call the review section key points, and that was based on survey feedback and medical review feedback. How is it diagnosed includes possible tests and what to expect. Here you might find information on genetic and tumor testing or staging. And how is it treated? Treatment chapters include an overview of treatments. So on the left, with treating bone cancer, you have an example of what the overview of treatments might look like. What types of surgery might you expect with your particular disease? Systemic therapies. So systemic therapies are used throughout the body. That would include chemotherapy, targeted therapy, and immunotherapy. Not all Cancers are treated with systemic therapy, and not all cancers are treated with chemotherapy. So these chapters are important because cancer treatment is becoming more precise, right? More personalized, more targeted. So you'll see in some diseases an emphasis on the targeted treatments, targeted therapies, and immunotherapies. So the treatment chapters include an overview of treatments as well as specific treatment recommendations based on cancer stage or disease subtype. So in some diseases, in pancreatic cancer, it's not based on the cancer stage, it's based on whether the tumor can be removed with surgery, which is called resectable or resectability. And some diseases have subtypes. Bone cancer is not just one type of cancer, it's actually several cancers and a couple of non-cancers that are treated like cancer. And here is large cell transformation, which some cancers can have different types of cells within the same cancer. Algorithms or treatment pathways in the clinical practice guideline look like this. So I did choose a really complicated one. They don't all look like this. So how do you translate this information into a patient-friendly book so that the same information looks like this in the patient guideline? So that's a really good question, and I can tell you it is a lot of work. And this is the result of just one algorithm page. There are many in each clinical practice guideline that must be interpreted and reflected in the patient guideline. So the integration of information is often repeated throughout the book, right? People don't read the books cover to cover. No one wants to read a 70-page book cover to cover on cancer. So it depends where you are in the stage. Maybe you're learning, you've just been diagnosed. Maybe you haven't been diagnosed, but you want to review how this cancer is tested. Maybe you're in treatment and you want to know more about the treatment. So as writers, we recognize that people flip throughout the books. We break up the content with sidebars and sticky notes, and there's chapter sections with images. I mean, we really try to, like I said, break it up, but we also repeat the information, recognizing that people don't read the books cover to cover. So in this example, this is example several pages from pediatric ALL. This was our first pediatric patient guideline. So what was tricky, one of the tricky things about the pediatric book is you can be an infant, a teen, or a young adult. You can also be as a young adult. So a young adult is someone up to age 30. So someone who's a young adult could also be treated at a pediatric center because it depends on your subtype of ALL. So when you're writing a book, you're writing to parents, right? Because you're writing to parents who have children with ALL. You're writing to teens and adolescents and young adults. So it can definitely be a challenge kind of covering all of that. Since we have in-house experts, we can ask pharmacists, pediatric nurses about the different devices that chemotherapy might be given. So this cancer is an example of one where chemotherapy is the backbone. But as I mentioned, chemotherapy really isn't the backbone of a lot of cancers anymore. It was helpful to talk to the pharmacist and the nurse to kind of get an idea of well, especially since she was a pediatric nurse, just to get an idea of what to expect. We also, as writers, do research to find out what needs to be emphasized. And so I particularly like the sticky note about children experiencing new and unusual sensations. Parents might not realize that if you flinch or you cringe when your child is getting a treatment or a blood test, that does affect your child. So that I learned something new, and we do try to share the things that we learn with the readers as well. Sidebar, sticky notes, and active net language lead to enhanced comprehension. The goal is to empower readers to take ownership of their care, be informed about care options, self-advocate, and engage in shared decision-making. Right, so we have the sections on questions to ask your doctors. As I mentioned, we use an active voice: bring, create, keep, tell, speak, talk. We really try to encourage people to speak up. It's very important to the doctors on the panel as well, as so we're really trying to be an advocate. Let's go into the weeds a little bit. Every effort is made to include a variety of races, ages, and ethnicities in images of people, whether patients or healthcare providers, and procedures that include people or anatomy. So whether, we recognize that the words are important, but images and illustrations hold a lot of weight, right? So a picture's worth 1,000 words. SEER demographic data is used to identify possible images. SEER stands for surveillance, epidemiology, and end results. We don't only look at the highest incidence, and we don't always put the highest incidence on the cover. It's just one piece of information we consider. The use of images and other visual elements. Every book relies on illustrations and images to convey and reinforce information and to highlight diversity. So this chapter image on the left was chosen because those with Down syndrome and ALL have special treatment considerations. On the upper right, we have a trans person for the non-muscle invasive bladder cancer treatment chapter. These were conscious choices. On the bottom right, we also have an image of surgery to remove part of the stomach. So it's very important. Almost everyone with stomach cancer will have surgery to remove the tumor or part of their stomach. So you do need illustrations to help explain and reinforce this information. We have illustrations of different parts of the body, such as in this case, the bone, and where a giant cell tumor might be found. Inside our books, we refer to other books. So you might find inside a book reference to anemia or reference to survivorship or reference to distress during cancer care. The Philadelphia chromosome is the hallmark of chronic myeloid leukemia. So you cannot avoid talking about complex genetic issues, genetic alterations, or as they call them, translocations. Like, you can't avoid it. You have to talk about it. So we do try to use illustrations, again, to help explain a complicated concept for sure. And in the bottom, these tables we call guides, and they usually list the specific treatments. And so it can be confusing. When I first started, it was like, the books are called patient guidelines, these tables are called guides, the clinical practice guidelines are called guidelines. So the word guide is used a lot. And I do recognize that. That is, I feel like that's a little bit of a challenge, but it's part of their branding. They like using the word guidelines. So every effort is made to represent a variety of skin colors. We call this non-human gray. We try to use that if we can. If we can find images, we purchase our images. It can be difficult to find freely available images that show a range of skin colors, but we do our best. We are also conscious of word choice. Gender neutral and sex neutral language is used throughout when possible. We are required to some extent to reflect what's in the clinical practice guidelines. So we have to be careful if, say, the clinical practice guidelines doesn't mention treatment for trans people, then we can't. So, but there is a process where we can say this needs to address, and we can submit, there's a kind of an official process where we can submit it in the panel meeting, and then they will discuss it. And they are very good at discussing all submissions. So as an outsider, you can submit something, say you think that something's very important and it's not included in the clinical version, then they will discuss it. So one of the, there were some changes recently in the adolescent and young adults. So now they do discuss trans and sex assigned at birth. They use better inclusive language. So we are making inroads with that. Age-sensitive language is used throughout. And as the writers, we try to avoid regional colloquialisms and other terms that might be perceived as slang, have multiple meanings, or may be difficult to translate. So remember, many of these books are translated into a variety of languages. I try not to use words like wax or wane, present or present, start a family, father, children, etc. In these are examples from the books. There's no mention of men, women, or males, females. Those who can become pregnant will be given a pregnancy test. So there's no reason to say women who can become pregnant or men who have testicles. You can talk about these tests without mentioning gender. You can talk about menopause without saying women, right? Your ovaries, your adrenal glands, I mean, those are the ones that make estrogen. So the same with some of these other areas. We use over and under instead of older and younger to prevent ageism. So no one wants to be considered or labeled old. And in questions to ask your doctors, we can address these issues of race, ethnicity, and gender. And so, for example, how many patients like me of the same age, gender, and race have you treated? So maybe in a book, we can't really talk about inequity, but we can encourage patients or people or caregivers. We try not to use patients. We try to use those with cancer or people, but in this instance, the word patient is used. To encourage them to say, like, how many people like you? If it's important to you, then you should speak up. So we try these kind of maybe subtle or not so subtle ways to encourage you to have a voice and say, I want someone who looks like me. Each book has a list of selected resources or websites for more information. Writers often use these resources as well. Resources are hyperlinked. On the right-hand side, we have an example of, I mentioned every book has a clinical trial piece. So this sidebar is included in every book where it, like I said, it's hyperlinked. So you can find clinical trials near you. Our books are downloaded worldwide. And so we do include clinical trials around the world as well. And then here's another survey bubble, as it were, to another opportunity to provide feedback. Here are a few lesser known resources I highly recommend. My favorites include animatedpatient.com, labtestsonline.org, medlineplus.gov, genetics, mysurvivalstory.org, radiologyinfo.org, rarediseases.org, skinofcolorsociety.org, urologyhealth.org. And there are many patient advocacy organizations as well that are great resources. National Institute of Health Resources. National Cancer Institute has an excellent dictionary. The writers use this dictionary. We have a words to know in the back of our books. We write our own definitions, but we also use the NCCI definitions. I mentioned that Medlines Plus has a genetics section, and it is well worth it. Genetics home reference is also helpful, especially when you're dealing with blood cancers such as MDS or AML. More and more cancer treatment is, as I mentioned, precision medicine. It is targeted therapy, and it's going to focus on genetics, molecular tests, proteins. And so these sections in Medline Plus or genetics home reference are really, really helpful to understanding certain diseases. So in conclusion, there's always room for growth. We seek feedback using 3 survey links in every book. This feedback is incorporated into text and design changes. We purchase our images, and it can be difficult to find diverse images of skin cancers and skin lymphomas. And word choice and language can always be improved upon. So as I mentioned, we now have 5 writers. We all have different backgrounds, different educational backgrounds, different experience, different lengths with the organization, just different areas of interest and what we advocate for. So the challenge, especially with breast cancer, is, men can also get breast cancer, and how do you use men and women or not use men and women, because men aren't women. And so that's an ongoing challenge. So that book, there were 3 breast cancer books that were updated last year, and they should be updated here again next year. And so what's nice is when you have time in between books, you have time to kind of process this information and think about how you can make it better. And also you can see where the clinical practice guidelines are in terms of using these words. And I have provided feedback on how we can do better. So there's always an opportunity to do better. The top 2 images are from skin cancer books. And so we have received feedback that the images, they're white, they're fair skinned, light skinned, however you prefer to describe the people represented in the images. And so sometimes it just takes more effort to find better images. And if we purchase our images and we're not getting what we need, then as writers, we have to advocate and say we're not getting what we need, and we need better images. The image on the bottom right is also on, as you can see, white skin, and that is an image in mycosis fungoides. So that's a skin lymphoma. As I mentioned, that is not a skin cancer. This image was from Wikimedia. It was freely available online, but again, there still are challenges of finding these disease descriptions on brown and black skin. The other thing we run into is you might find an image and the caption might say it's of a certain thing, and then that might be clinically inaccurate. So the medical reviewers have to review all the images, everything in the book, to make sure that you're accurately describing what needs to be described. I mentioned before, we really don't need to say he or she, or men or women, and you can see some of the highlight examples. You don't need to talk about your doctor as he or she. They can help get you the food. It just takes some time, an effort to rewrite a sentence. And the same with screening programs exist for prostate cancer men, breast and cervical cancer women, and colorectal cancer. So I mean, I didn't write this, but I'm not sure why the writer felt like they had to use the word men or women. So I think it's just a change in thinking. And as we all know, it does. It takes time, it takes effort, and we can always do better, can always do better. I want to thank you again for attending this presentation. To learn more or keep this conversation going, you can reach me via email at Fisher, which is FISCHER, @nccn.org.